The first slide I'm going to talk about is just, like I said, some raw data about opioid deaths in all the counties in PD16, and comparing it to opioid deaths for 2021 for the state of Virginia, for the Commonwealth. As you can see, in all our communities, we are higher than the Commonwealth, and Spotsy is right there at number 3 for PD16. Now, again, please note these are opioid deaths. In the next slide, I will look at opioid deaths rates. The first slide was opioid death rates. These are actual numbers of deaths in Spotsylvania over the last 5 years, from 2017 to 2021. And I think it's self-descriptive of what we're seeing in the community. The next slide, which is, and remember, this is opioid death rates, the first slide. Now, these ED visits. And to break that down, what you would like to see, of course, is opioid death rates going down and ED visits going up, because people are, if they get to use drugs for whatever reason, illicit or otherwise, or prescription, they are using it, overdosing, and making it to the ED. But if the ED visits are kind of all over the place as it is now and sort of trending downwards, and our deaths are trending upwards, kind of what does that mean? I'll leave it to you, but for me, when I think about it, it just kind of tells me people that maybe using drugs on their own, which is a bit of, kind of not what we want to see. Lenny?
Yeah, and just to kind of my name's Eleni McNeil. I work at RACSB. I'm the substance use coordinator. I'm a licensed clinical social worker there. And just to piggyback on what Dr. O said, a vast majority of overdoses occur in the home, and there's lots of opportunities for interventions that we miss. And so I want to talk to you guys about what harm reduction is, because this is a great modality that gives more opportunities to intervene to prevent somebody from dying from opiate use. So when we think about harm reduction, before I jump into what it is with opiate use, I want us to just get a good frame of reference for what it is across society. When we put sunscreen on to go outside in the summertime to prevent sunburn, we are using harm reduction. When we are using nicotine patches to stop smoking cigarettes, that is a method of harm reduction. When we put bike helmets on our kids to ride their scooters or their bicycles out in the community, that's harm reduction, because we're trying to do something to keep them safer while they're doing an activity that can be dangerous. And so I want you to keep these things and some of the other things on this slide in mind while I talk to you about what harm reduction looks like with opiate use. Because as you could see from the first few slides, this is a big problem in our community and people are losing their lives. So when we think of harm reduction in context of opiate use, it is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use, which can be really simplified into just thinking of it as harm reduction reduces harm. That's our goal here, reducing harm. It's a strategy of meeting people where they're at when they may not yet be ready to stop using, to keep them alive while also working with them to try and move them along in maybe starting to think about making some changes. So I think this slide is really important because sometimes people hear harm reduction and they kind of have some feelings come up about it and start making some assumptions on what it might be. Harm reduction is never encouraging somebody to use, ever. It is never just telling them, you do you go ahead. It's not condoning risky or dangerous behaviors at all. And it's never discouraging or dismissing an abstinence model of treatment if somebody is ready to stop using. We are never telling somebody that's saying, I'm ready to quit. No, keep using, because that is not what our message is here at all. You know, sometimes people are concerned about the politics around drug policies and drug interventions, and I think it's really important to note that harm reduction as a spectrum has bipartisan support at the state level and at the national level. The Biden and Harris administration has identified harm reduction as a priority, specifically through Narcan distribution, fentanyl testing strips, and other modalities. And in our state, Governor Youngkin actually recently signed an executive order as well on Fentanyl Awareness Day under his comprehensive plan to fight Virginia's fentanyl crisis. And he outlined several strategies within that executive order on things that he thinks Virginia should prioritize to address our opioid crisis. Harm reduction also has decades of research behind it showing that it can save lives and it is cost effective in the long term. You know, I know we're always looking at budget and how can we stretch our money to get the most bang for our buck. Harm reduction is shown that short-term investment can pay off in the long term. There's lots of positive benefits with harm reduction. People that are using experience less judgment and stigma. There's reduced disease transmission, specifically when you look at people that are using needles to use their drugs through hepatitis C and HIV, and then dirty needles being in the community. There's a reduced risk of overdose deaths, including accidental overdoses. Sometimes an accidental overdose might be a child who got a hold of their parents' prescription medication that fell out of the bottle. It doesn't always even have to be an illicit use. Reduced health complications from people that are using drugs via IV. I also want to point out, our first responders are impacted by this too. They're the ones that are responding when there's a 911 call. They're the ones that are having to tell families that their loved one has passed away. And if we can stop people from dying for this, that's less parents that our first responders have to tell that have lost a loved one. And I think that's really important to mention as well. And, I mentioned the cost over time. It also increases people's likelihood of accessing treatment in the long run because they are not feeling judged or stigmatized, and they're building trust and building a relationship with the people that are having these conversations with them. So when we actually look at harm reduction interventions, it's kind of like a continuum of care, and it's no one size fits all. It's really dependent on the person, the community, the family, what's going to work best for what's going on with that person. And you have, on one end of the spectrum, you have Good Samaritan laws. Virginia just passed some that took effect last July to encourage people to call 911 and not have to be fearful of facing charges. Educating clients on safer use, particularly our clients that are using needles to use their drugs. We might educate them on the risk of Hep C and HIV transmission and encouraging them to consider alternate routes of use. Medication-assisted treatment is another harm reduction method that we use in our community currently. That includes treatments such as methadone, Suboxone, and Vivitrol, which all help manage the urges and cravings to use when somebody's trying to get sober off of opiates. Naloxone, which some of you might also know as Narcan, is a harm reduction strategy. It is the overdose reversal drug. So if somebody has overdosed and they're administered Narcan, it can help remove the opiates out of their system temporarily to buy them time to get to the hospital instead of them dying.